Mako. This is one of our favorite times of the year, is seeing all the beautiful new people who are coming into the field of nursing and giving their service this time in Hawaii. So I'm going to begin with a blessing oli that says, Ua ola loko I ke aloha, ua ola loko ma lama lama. Ma lama lama is one of the logos of the university, and it means an enlightened state when everyone collectively carries the light of aloha. And this is what that chant is about. I gave it to you a little bit when in your orientation gatherings this week. I hope you've had a really great week. And the chorus to this is the A, E, I, O, U, which are the universal language of all human beings. Ua ola loko I ke aloha, ua ola loko ma lama lama e o. Ua ola loko I ke aloha, ola loko ma lama lama e o. All blessings on Maui. Mahalo.
Thank you, Nalani. And aloha, welcome to the University of Hawaii at Manoa, Nancy Atmosphero Walsh School of Nursing Pledging Ceremony. We're pleased to welcome the Baccalaureate Nursing Class of 2026 to our School of Harvard. My name is John Caston, and I'm the Nursing Department Chair. And I'm delighted to welcome all of you to our incoming nursing students, school administrators, Dean Clementina Surya-Ulip, and Associate Dean Laurie Wong, our keynote speaker, proud alumni Marvin Kamba, our faculty, volunteers from the Student Nurses Association, colleagues, family, and friends. Together, we celebrate the commitment of these new nursing students as they begin on a journey towards a rewarding and exciting career in nursing. We applaud each of you, students, as you begin your journey. You will soon become tomorrow's healthcare professionals and leaders in Hawaii and the world. At this time, I'm very pleased to introduce Dean Surya-Ulip for her remarks. Please.
Thank you, Dr. Kaskin. Good evening to all our new students, family, relatives, and friends, faculty and staff. Aloha and welcome. A brief history on the Nursing Pledge. This modified Hippocratic Oath was composed in 1893 by Lystra E. Greder and a committee for the Farron Training School for Nurses in Detroit. It was called the Florence Nightingale Pledge in appreciation for the founder of modern nursing. This pledge serves as a professional mission statement, one that truly reflects the deep-seated vision and values of nursing. It is a modified version of the Hippocratic Oath for doctors, whereby nurses pledge to uphold certain ethics and principles within the nursing profession. This evening, we will remember or commemorate the founder of nursing, Florence Nightingale. We will witness our new students pledging to deliver care that is patient-centered, current, and of the highest standard. They will also pledge to promote the health and well-being of their community and humankind and more. Such steadfast, faithful commitment expressed in the nursing pledge by our students, I believe, is why time and time again, the Gallup survey has shown that nursing is the most ethical and trusted profession in the world. In closing, thank you all for coming to this important event, a rite of passage for our new students as they enter the nursing profession. Thank you.
Thank you, Dean Ula, for those remarks. Now it is my pleasure to introduce our keynote speaker, Melvin Campbell. Melvin, please.
All right, is everyone awake? I hope you're awake after this as well. If you don't mind, I prepared a script so I wouldn't forget anything. First off, I want to thank the School of Nursing, Dr. Caskin and Dr. Clam for inviting me. It's an honor and privilege for me to be here today, a place where I started my nursing journey just like you. So, welcome to this profession. This is something to be proud of. I know you will be successful, but I also know that there are times that will be challenging, and you will be emotionally, mentally, and physically stressed. But always remember why you got here and the reason you chose to become a nurse. Right now, I was talking to some of the nursing students out there, and I said, you probably feel excited, nervous, scared, anxious, and like all of us, heartbroken as we think about our Maui Ohana. And we feel the need to do something. Excuse me. Seeing our communities coming together to help each other in times of need inspires us all. You have what it takes to be a nurse, regardless of what comes your way, to help someone in need. And look around you. I know it's kind of dark, but you have your family surrounded here to support you, motivate you, and get you through some tough times. Our world needs you, especially in the world we live today. Nurses, like what Dr. Clem said, are the backbone of our healthcare system, and it is a rewarding profession. We are on the front lines and we take care of patients at their most vulnerable state. You heard of the quote, at the end of the day, people won't remember what you said or did, they will remember how you made them feel. There are going to be times when you question yourself and your skills. All of us who went through BSN, I brought my classmate here, Gretchen. Remember when we had some challenges ourselves, we had doubts in becoming a nurse back then, and even though we've always had that special bond to help someone and have that interpersonal connection, we found our way. It was natural for me to have that sense of nurturing, taking care of people and family members, including my grandma. She had Alzheimer's and kidney failure. She lived until she was 99 years old. So and it was over the years I spent taking care of her that I realized that nursing was my calling, and there was more to it than bedside nursing, where I began, like many of us. I'm proud to have received my BSN here at University of Hawaii. As with many of you, I had to find means to pay for my tuition. I applied for scholarships and of course loans. I also worked part-time at the medical clinic at Queens. So undergraduate was really tough, but I was able to persevere without the support from a lot of people here, and of course our families. So even though the path wasn't a smooth road, our class made it fun. We joined a lot of extracurricular activities, student nurses organization, joined that was fun. And at one point I think I was president and we did a lot of barbecues. We held massages on the floor for the students. We went to Florida and Pennsylvania for the NSNA conference where we meet a lot of the other nursing students from all over. And you're probably thinking, when do we have time to study? We found areas and times to study. And my key here was we formed study groups. My advice to you is find what's best for you. So after graduation, I applied everywhere. I was worried about not getting a job right away. I applied locally and at UCLA's new grad program because I wanted to work in the OR, operating room. Of all the jobs that I got offered with, I was asked to work at a new endoscopy clinic in Honolulu. Physicians from our local hospitals foresaw a need for the state-of-the-art facility to perform screenings, diagnostics, and therapeutic endoscopies of all kinds. So no ifs and buts about it, I became one of the first nurses to start this new endoscopy clinic along with other nurses who have worked in this field for a very long time. My clinic director at the time was hesitant to hire me because I was a new grad and I was nervous. But it was my mentors who put in a good recommendation and I'm very grateful for that. But I still needed to prove that I deserve a chance, to prove my own merit by going through the interview process, updating my resume, trainings, tests, learning on the job, and fulfill my duties as a nurse. So the pearls here, nursing students, get to know your mentors. It's important to make a first impression, but your last impression will help you in the long run. I had to bring myself forward and apply what I learned in nursing school. There were challenges, but I worked there for 8 years and learned so much. It was a really fast-paced environment, but with the heart of nursing, I made every effort to advocate for our patients and always make them feel like they've gotten the best care. It was a rewarding experience to care for patients at bedside and going into communities to promote screenings. And I learned all the different GI issues that we've been seeing. We've been seeing colon cancer in the younger generations. And we learned the new guidelines is now regular screenings at age 45 rather than 50. And my curiosity came, why are we seeing this? Is it the food that we're eating? Is it in our genetics? What kind of preventative measures could this person have taken? That's when I decided that I wanted to advance my nursing career. And I applied for my master's here at UH. I wanted to make a greater impact. During that time, I had to juggle with work and school while caring for family. Then my former boss told me that, hey, there's a nursing position that oversees a work site, and I would be managing a clinic out on the west side, closer to home. Well, I took that job offer, not knowing the specialized field that I am now in, which is occupational and environmental health nursing. I would be the site for a global company, the site nurse for a global company who oversees the workplace of industries. I was hesitant at first because I didn't know about this field, but I took the job because I knew it would fit my family schedule. It's just being real. When I arrived at the clinic, I learned that prior to having occupational health nurses, physician assistants were managing the clinic. And I wondered why the change from PAs to nurses. So it's important to know that the history of occupational health nursing, which began during the Industrial Revolution in 18th century. The first industrial nurse in the US was Ada Mayo Stewart, who was hired at the Vermont Marble Company. She cared for work-related injuries and strains, gashes, and even delivered babies with no running water or electricity. Over time, she established a rapport with these workers and families, similar to my relationship with my workers. Famous buildings such as Thomas Jefferson Memorial, Arlington Memorial Bridge, and many other places are actually made of Vermont marble. Lillian Wald is known as the founder of public health nursing and advocated for workplace health and safety. Betty Mulder provided care for coal miners and their families. And we all know Florence Nightingale, who became one of the pioneers of the nursing profession. So occupational health became my new passion. I cannot express how important my role is in healthcare. I must say that I am in a unique position to promote healthy environments, healthy workplaces, early detection, and minimize diseases or injuries, and address the health issues that we see today in hospitals, nursing homes, and communities. Going to conferences are something that I look forward to because it reminds me that there's a bigger world and a bigger picture out there. And it's nice to come together with a strong community. We create a bond, not just workers, but also families and each other. We perform health exams. So that's the stuff you will learn in your first semester, and that's the stuff that I thought I would never use again. So it was important to conduct a full health history exam. We do head-to-toe assessments, lots of range of motions, checking vision, assessing reflexes, upper and lower extremities, using the otoscope. I've never used the otoscope till my first year in nursing school, taking blood pressure, auscultating their lungs. There are all different kinds of levels, and it all depends what the company is looking for, either more in depth or basic head to toe. We also clear workers through a physical or functional test. Other job positions include pilots, truck drivers. So there's even nurses in the space industry. So if anybody want to work for NASA, they're space nurses. Challenges. Normally we know what the day looks like, but anything can throw our day off. Someone can get into an accident and will drop everything and respond right away. Or someone returning to work with symptoms and uncontrolled diabetes or had a seizure the day before. This may be a different setting for you, but it doesn't matter what type of nursing you do. We have to always prioritize, readjust, and reassess. We think it's going great, but we'll have boomerangs that will throw us off. So not only do we see work-related issues, but also non-work. And I try to refer them back to their doctor, but I find out they don't have a doctor. They haven't seen a doctor for years. And now I'm seeing all these issues, and then I realize why nurses are needed in this type of setting. We are the best healthcare professionals, like Dr. Clem said, at the work sites in our communities to promote and protect the health of our workforce. We are problem solvers and detectives. We are the voice for our communities. And in many instances, true story, when I'm doing health screenings, I always pick up something. This person is having an AFib, or they have Crohn's disease. How do we manage clinical symptoms and still be productive? If an employee returns to work, he is 6 weeks after a post-cardiac arrest. What are we to do? Do we clear them? Whenever we have this question, we collaborate as a team. We have an occupational health team with board-certified providers and nurse practitioners. So there is a room for you to advance your career. So nurses are part of these hard conversations, and one day you will be that nurse to make these decisions. You will be advocating for them. All right, so this is the time for me to ask, how are you all doing? You still good? You with me? Almost done. All right. So we look at occupational issues in the news, including world issues and environmental issues, and how climate change can affect our health. And we nurses can advocate for policy change. Wild smoke we see contains particulate matter and other compounds that reduces our air quality. So there's going to be trips to the ER and hospitalizations. Anyone with chronic underlying issues are greatly affected. And we can see that after a heavy drought of rain, we worry about mold in our homes or buildings. We worry about us inhaling those small spores. So we know that we've been hitting warmer climates now. We worry about heat exhaustion. In fact, I actually focused my capstone project on mitigating ways to prevent heat illnesses among farmers on the Big Island. And I had the opportunity to be part of a research study on disaster preparedness, where I learned that we should start having these conversations in our families, and also maybe at the doctor's office. Sometimes we don't talk about that. So that's an opportunity there. And I realized that my dad worked at a Wawa sugar mill, and I see the effects from his loud noise exposure because he's partially deaf. He has to repeat and always ask, what? Can you repeat it? Did you not wear your hearing protection? So in communities, we learn all of these things: lead pipes in Michigan, access to clean water. Here on our island, you hear about the contaminated water. So the environmental factors that impact our health and well-being are very, very important. Externally and internally, we need to understand the impact it has on our brain function, cardiovascular, and health. And understand that nurses like you can voice their concerns, whether it be at the job site, your chief nursing operator, legislators, schools, and public officials. So over time, you will obtain all the skills, and who knows, you may even have the potential to be self-employed too. There are opportunities out there when you advance your education. And when you get hired, you learn on the job and may earn some free education. I was able to finish graduate school and recently earned my master's degree in advanced population health. As I'm seeing all kinds of issues from local to global level, I gain a better perspective and learn to approach things better to help improve health outcomes. I wasn't in the conversation with our leadership teams until I've been addressing these issues that was impacting their health. So I was, more of the quiet type. I didn't really speak my voice until now. Now this person can't be cleared he has high blood pressure, he has all these other issues. So I'm now the voice for all my workers. And I challenge you, nursing students, that when you start your nursing journey and begin conducting your own assessments, I want you to think about the patterns and behaviors that could be contributing to your patient's health. And as nurses, we want to break the cycle. Part of your assessment, you can include environmental issues and ask, where did they work, what did they do? And there's one story that one employee shared that he had an open wound, he's diabetic, and he thought cleaning his wound in the ocean was good. But sure enough, we know the contaminated water results in, not the greatest treatment. So we want to think about that, why not just the signs and symptoms of infection, but also assess the environment. So nursing is the greatest investment, and remember to take care of yourself. Lean on to each other, your families and friends, and lean on to your mentors. Invest in your nursing practice, join organizations, whatever your passion is, advocate for your nursing career. There will be people out there to support you. Strongly get involved. You are part of the process and the movement to change the world. And celebrate those small wins. Life can be overwhelming. Make those connections with people you meet, and especially the people around you. Because you are doing this together, you'll be lifelong friends and colleagues. Lastly, I hope that some of these pearls of wisdom and experiences resonate with you, and I wish you good health and all the best on your nursing journey. You make the experience. Continue learning and consider advancing your education, even if it takes a while, like I did. The more you know, the less you know. It's a lifetime journey for all of us. And if you're interested in this field, please reach out to me. If you have a passion to develop a project or partner with me in creating a healthier environment, please let me know. Your goal is to finish nursing school. You'll discover what kind of nurse you'll be, why you love your job, and why you've chosen this field. You will all be people who take care of each other and of me, because I'm gonna get old, and your instructors, because they're gonna get older. We look forward
to your pinning and graduation day. We can change the world and make it a better place. It is in your hands to make a difference. So let's get out and change the world. Thank you.
Thank you, Melvin. There's nothing like making a major boo-boo when you have a presentation, and I skipped 2 pages introducing Melvin. But you could see why we invited Melvin to be the keynote speaker. Because for you students, beginning students, your career, Melvin is in some ways the epitome of what a nurse can be. She worked in the hospital, she's now working in the field, occupational and environmental health. What you're going to find in these first years in your schooling at the Norton School is you're going to get a very solid grounding in nursing science as well as nursing care. And Melvin has expressed that fully. So don't be thinking that the hospital is the only place for you. Florence Nightingale didn't think that either. So just a little bit about then, now that I'm back on script again, and my apologies, Melvin, for not doing a proper, I should note too, on a personal note, Melvin was one of my students. And you can think how lucky I was to have somebody who was so excited about environmental and occupational health, as well as everything else. And she still has her own family. She's raising a family. So everything is possible for nurses. Thank you, Melvin. Okay. Okay, they were indeed inspirational words, but a little bit of information about the Nursing Pledge, a tradition in nursing related to Florence Nightingale. Florence Nightingale was born in Italy in 1820. She received her initial training at a hospital run by an order of Protestant deaconesses and gained further experience as a superintendent of a hospital for invalid women in London. After reading in the London Times in 1854, on the plight of wounded soldiers fighting in the Crimea, Nightingale asked the British Secretary of War to secure her an entrance into the military hospitals in Turkey. He not only granted her permission to visit the hospitals, but made her the official head of a delegation of nurses. Nightingale worked for the next 2 years to improve the sanitary conditions of army hospitals and to reorganize their administration. The Times newspaper immortalized her as the lady with the lamp because she ministered to the soldiers throughout the night. So you will often see her with a little light in her hand. Later, Nightingale conducted a study of the health of the British Army and created a plan for reform affecting the health, efficiency, and hospital administration of the British Army. She also established a nursing school in London. Nightingale gave voice to a new idea, that nursing's mission is involved not only in caring for the individual, but for the community and society at large. Florence believed that social policies were essential to improving health, an idea that remains an essential part of nursing even today. She never stopped advancing the art and science of nursing at the bedside, promoting a quest for new knowledge and expertise that remains a driving force in nursing to this day. Nightingale inspired generations of nursing students. The Nursing Pledge speaks to the commitment of the individual nurse to the profession of caring for individuals, families, the community, and society. So we will now proceed with the pledging of the Baccalaureate Nursing Class of 2026, and I'd like to invite Melanie Yang the Student Nurse Association President, to come forward and lead our new student in the pledging ceremony.
Watch your eyes as the lights come on.
On behalf of SNA and the nursing student body, I welcome all new nursing students to come forward in their assigned order. Please introduce yourself as you take your place.
Joshua Ponton. Gleb Gorbachev. Makakoa Pelletier Final. Warren Aguinaldo. Yuki Segura. Lawrence Trudeau.
Shelby McCrory.
Alton Jacob Tumupter. Brian Tabios. Brian Dorday. Kronos Baker.
Abigail Jenkinson.
Roman Dolas.
Mary Hull. Giselle Guitat. Courtney Arume.
John Christopher Carl. Darren Leon.
Francesca Mataham. Paige Thomas. Kayla Regis.
Nathan Ching.
Ariane Janelle Domingo. Kelsey Yoshioka. Anthony Alvaro. Aaron Ray Hufana. Emmy Darwin. Audrey Introduces. Eva Turk. Carly Marume. Selena Tong. Kara Saruatari.
Eric Damon.
Anna Jaffe. Regine Raimundo. Rose Weedy. Shalay Fong. Brianna Gomez. Alana Victoria Levette. Sky Daly. Coletta Andrade. Angeli May Takdaran. Taylor Uehara.
Jomea Salvin Viernes.
Princess Kaylin Ballesteros.
Emily Quach. Faye Sarah.
So due to fire safety concerns, we are omitting the use of candles. May the incoming nursing students please stand, turn around, and raise your right hand. Colleagues, please join me in taking the Nurses Pledge by repeating after me. I solemnly pledge myself in the presence of this assembly to faithfully practice my profession of nursing.
I solemnly pledge myself in the presence of this assembly to faithfully practice my profession of nursing.
I will do all in my power to make and maintain the highest standards and practices of my profession.
I will do all in my power to make and maintain the highest standards and practices of my profession.
I will hold in confidence all personal matters committed to my keeping in the practice of my calling.
I will hold in confidence all personal matters committed to my keeping in the practice of my calling.
I will devote myself to the welfare of my patients, my family, and my community.
I will devote myself to the welfare of my patients, my family, and my community.
I will endeavor to fulfill my rights and privileges as a good citizen and take my share of responsibility in promoting the health and welfare of my community.
I will endeavor to fulfill my rights and privileges as a good citizen and take my share of responsibility in promoting the health and welfare of my community.
I will constantly endeavor to increase my knowledge and skills in nursing and to use them wisely.
I will constantly endeavor to increase my knowledge and skills in nursing and to use them wisely.
I will zealously seek to nurse those who are ill, wherever they may be and whenever they are in need.
I will zealously seek to nurse those who are ill, wherever they may be and whenever they are in need.
I will be active in assisting others in safeguarding and promoting the health and happiness of humankind.
I will be active in assisting others in safeguarding and promoting the health and happiness of humankind.
Audience, please join me in a round of applause for the incoming baccalaureate nursing class of 2021. Incoming class, you may now sit. I invite John Caskin back to the stage to provide closing remarks.
I would like to extend a special thanks to the Student Nurses Association volunteers, you see them in those green scrubs, for participating in the new student orientation and helping with this pledging ceremony. Please join me for a round of applause for our student volunteers. And now some rather important instructions. At the conclusion of the program, the nursing class of 2026 will take a group photograph at the Campus Center courtyard, and they will exit the auditorium first. The students will return to the auditorium afterwards, and then we'll join our guests outside for refreshments. So at this time, please give one final round of applause to congratulate our incoming nursing students. The audience is seated until the students have exited. So